When we think about life-saving tools in medicine, our minds probably jump to these massive, complex, high-tech machines, right? But what if I told you one of the most powerful tools out there isn't a machine at all, but a simple checklist? Today, we're going to pull back the curtain on a tool like that, one that brings absolute clarity to life or death decisions. So, picture this. You're a doctor in a crazy busy emergency room. A patient gets wheeled in. They're coughing, they have a fever, they can barely catch their breath. You know right away, it's pneumonia. But here's the million-dollar question. How bad is it? Is this something you can treat at home, or is this patient literally on the brink of a major crisis? You've got to make the call, and you've got to make it now. And this one decision, well, it's everything. If you send someone home when they're too sick, they could get dangerously worse. But if you admit them to the ICU unnecessarily, you're tying up a critical bed that someone else might desperately need. The stakes couldn't be higher. Getting this right is, and I mean this literally, the difference between life and death. This is exactly where a simple, almost elegant tool comes into play. It's called the CURB-65 score. It was designed specifically to cut through all that chaos and give a clear answer to that one critical question. It's really the hero of our story today. So, what is it exactly? Well, to put it simply, CURB-65 is a scoring system. It takes 5 key red flags from a patient's condition and boils them all down to just one single number. And that score tells doctors exactly how high the risk is and, most importantly, what to do about it. So, how does this actually work? Let's decode this thing letter by letter. Each letter, and that number at the end, stands for one simple question a doctor can answer right at the bedside. It's a beautifully simple 5-point checklist. First up, C is for confusion. Is the patient suddenly disoriented? Are they not thinking clearly? Now, this is a huge red flag because it suggests the infection isn't just stuck in the lungs anymore. It's become so severe that it's starting to affect the entire body, even the brain. Next, we have U, and that stands for urea. This one you check with a simple blood test. It tells us how well the kidneys are doing their job of filtering waste. See, a really bad infection puts the whole body under enormous stress, and the kidneys are often one of the first organs to show that strain. And there's a specific number doctors look for. If that blood urea nitrogen level ticks up over 42 milligrams per deciliter, boom, that's a point on the score. It's a clear, objective sign that the body's organs are in trouble. R is for respiratory rate. This is a super direct way to see just how hard someone is working to breathe. A healthy person at rest takes, maybe 12 to 20 breaths a minute? But when pneumonia takes hold, that number can just go through the roof. The magic number here is 30 or more breaths per minute. I mean, that's fast. That frantic pace is a crystal clear sign that the patient is in serious trouble and their body is screaming for oxygen. B is for blood pressure. And what we're really looking for here is a low blood pressure. When you have a massive infection, the body can kind of go haywire, causing blood vessels to open up and pressure to just plummet. This is a massive warning sign of septic shock, where your vital organs just aren't getting the blood they need to survive. Clinically, the alarm bell starts ringing if that top number, the systolic, drops below 90, or if the bottom number, the diastolic, is below 60. Either one of those gets you a point. And finally, we have the number 65. Is the patient 65 or older? It's that simple. Age itself is a huge risk factor. As we get older, our immune systems just don't have the same punch, making it much harder to fight off a powerful infection like pneumonia. So let's recap. We have our 5 factors: confusion, urea, respiratory rate, blood pressure, and age 65. Each one is a piece of the puzzle. And now, this is the aha moment. Let's see how adding them all up creates a clear, immediate plan of action. The scoring could not be easier. For every one of those 5 criteria that's a yes for the patient, they get 1 point. That's it. You just tally them up for a score between 0 and 5. Simple. And this, right here, is where the true power of the score shines. That single number translates directly into a game plan. A score of 0 or 1, low risk. The patient can probably be treated safely at home. A score of 2? Okay, the risk is higher. They need to be admitted to the hospital. But a score of 3 or more, that patient is in serious danger and needs to be evaluated for ICU care right away. Okay, so obviously this tool is a huge help for individual patients, but its impact is actually much, much bigger than that. Let's zoom out for a second and look at why this simple little score is so important for the entire healthcare system. You see, the real genius of CURB-65 is that it standardizes care. It makes sure every single patient gets the same objective assessment, whether they're in a tiny rural hospital or a giant urban medical center. It swaps out a doctor's gut feeling for hard data, and that helps us use precious resources, like those ICU beds, for the people who truly need them the most. And when you put all that together, you just get better outcomes for everyone. It's a system that's literally saving lives with simple math. It really is the perfect example of the power of a simple, elegant tool in a very complex world. CURB-65 gives doctors the confidence to make better, faster, and more consistent decisions when the pressure is really on. This is evidence-based medicine at its absolute finest. And that kind of leaves us with a pretty fascinating thought, doesn't it? In a world that's always chasing the next complicated, high-tech solution, how many other life-saving breakthroughs are just waiting to be found? Not in some fancy lab, but hidden in plain sight, inside a simple checklist.